Good evening, everyone. It's been a little while, but I would like to get back to basics with another COVID-19 update. There's been a lot of things that's been happening, and I wanted to apply my special graph that I made up to see what it shows for these parts of the country where we clearly have a third wave of outbreaks if we look at it nationally. But again, looking at nationally is low resolution way to look at it. We want to increase our resolution, and we want to look at the states that are having problems individually, state by state. There's drawbacks to doing it that way, but it's better than lumping the whole country together. And when I do that, I actually saw some hope for the Great Plains state. And I'll talk about this, I'll show it to you, and I'll say what it means by the end of this update. If you look at it nationally, you can see we're definitely in the third wave of COVID. By the U.S. as a whole, we've had two waves of about equal hospitalizations. It seems that each wave is hitting a larger part of the country. The first wave basically hit the Northeast. The second wave hit the entire South. And the third wave is now hitting the middle of the country, mostly the parts that it hasn't hit before. And you can see as far as cases, as far as hospitalizations in the middle, that's blue, and as far as deaths, we have increasing numbers on all of those. In fact, looking at these graphs the way it looks, they look like a straight line going up, and that's really scary, and it is really scary. But I also want to say these graphs go back to March. What do we do if we zoom in and we look at these three kinds of graphs at a closer level? They're definitely still going up, but they're no longer looking like vertical lines. On a scale of the season, these are ones that start roughly at September 1st, we now see that the slope of these lines is steep and scary, but the new cases slope may be starting to tip over. Now, this is following, if you look at these carefully, you can see a pattern week by week that you have fewer cases reported over the weekend. And it's very clear that some of that is contributing to the flattening that you see in the red new cases line on the far left. However, all that's to say, there's some of that may be real. And what we want to do is we want to look at the hardest hit places to see if that might be reflected in the hardest hit places where we want it to be coming down the most. The other thing that I want to make sure is clear from the beginning here, deaths are going up again. We had almost 2,000 deaths in one day. But also, again, because of the week-by-week reporting, it's important to look at these things as 7-day averages rather than as an individual day. You know, for example, on this COVID tracking project page, you see that letter B on the gray graph on the right. That was a day in which there was a data dump of a lot of old data that was reported publicly for the first time that day. But that data actually applied to deaths that had occurred over the past month or so. So all that's to say, any day by day, you have only a contribution to what's going on. What you really want to look at is the 7-day average. And there is no doubt that all three lines are going up. But we're hoping to see some signs of one of the lines, hopefully the cases, because cases turn into hospitalizations which turn into deaths. If we're going to see a line flattening, hopefully it's in the cases line. But I also, it's easy to look at the cases line. You can actually go to this site that I have listed right here to look at my favorite kind of graph for these, the drop-down graph, and it has cases and deaths. So you can do that for any state that you want right now. And so you can compare these, but I wanted to look at the drop-down graphs of hospital bed occupancy, which is a little bit harder to do, but I came up with a little formula that I think captures most of what's going on, and it's the same kind of idea. Now, I'm not going to go into the details of the formula, but the basic thing is on these graphs, they show the evolution of the disease over time. They show how many people are in hospital beds in my case. And the thing about these graphs is northeast is bad, down, south is good. It's kind of like gravity's pulling this down. The farther down the line goes, and that's rather intuitive. So that's why one of the things I like about these graphs. They show the harder kind of data to get to, but also I think the most meaningful kind of data. The number of people sick enough to be in hospital beds are the measure that we should be taking of this, and the measure we're most scared of overwhelming is our hospital bed occupancy. And also, you know, on top of that, there's all sorts of other factors like hospital staff hours. Those are being run ragged in the middle of the country right now. Is there any hope that they might be able to to see some relief in the coming weeks. And so the other thing that I do with all my graphs is I correct them to be per capita, because I want to see how bad things are in South Dakota. And yes, hospital bed occupancy does vary a bit from place to place, but in general, you're going to have more similarities. More people mean more beds. And so I've corrected these for population as a quick way to sort of normalize them to each other, so that you can say, how bad are things really in South Dakota right now? You don't want to underestimate how bad things are, because South Dakota has like less than 1 million people. I think they have 0.8 million people. So this is what I did, and you can go back and you can look at the August 23 data update to see these things. And this is when I applied it to mostly the states in the South, but also other states I wanted to look at. The thing I want to remind you of, if you've seen this graph before, again, the red arrow shows the bad direction, the green arrow shows the good direction. You want things to drop down. And this was at a point where the New York hospital beds had emptied out. But also you can see on a per capita basis, the New York line is this gray line right here. And the gray line hit a maximum almost at the very top of this graph. The next graph is on the exact same scale. So we can compare how South Dakota is doing on a per capita basis to how New York was doing back in April, when their hospital beds were maxed out. I consider this to be the maxed out hospital staff, because New York barely got through this, right? And so there's a lot of ups and downs, and you've got to consider this as a log graph and things like that. But all this is to say, New York is the worst case scenario. How are we doing at avoiding repeating another New York? That line up there tells us how far away we are from this crude measure of it. The other thing I'd like to point out is that we were looking at several states. You see the state in the middle that's in purple for the LSU colors, that is Louisiana. And Louisiana had a first wave and a second wave. It had 2 true waves. You had some other states that had maybe 2 waves, but they were mostly definitely smaller than Louisiana's 2 big waves. And so I wanted to compare to Louisiana, and actually you can watch that line. So watch the Louisiana line here, and watch the Washington line. I'm going to keep the same colors and the same scale, but I'm going to flip the other states out as we go back. This is today. So if you look at the purple line, let me go back and forth. You see right there, the purple line, it's come down, and now Louisiana's bumping up again. Also with Washington, we were right here, and we were coming down, and we continued to come down after August. And then we bounced up again, starting in, I believe it was October, where we started to see that bounce come up again. And now we're actually higher than we have been since we were reporting. And the only thing I have to say is we weren't actually reporting statewide hospitalizations at the very height of the previous wave when it hit us, because we were hit so early. So all that's to say, Washington may not be as high as they were before. We don't know. It's definitely as high as been reported, and it's bad. But how bad? If you look at it on a per capita basis, you see that Washington's line is still below these other lines that we're seeing. We're still below even where Louisiana started to bump up. Louisiana's a smaller state, and they have more people in the hospital right now. But mostly what's useful for these graphs is not just to see where you are, but to project where you might be growing. Most of these lines, you see that these lines do wiggle around a little bit, but for the most part they follow relatively simple trajectories. And so we can see that Louisiana has that nice bounce right there. And when you step back and look at it this way, you can see that there's almost not quite a bell curve distribution, but there's something going on that's like that. Oh, by the way, I should also show you the brown line right here. There's the California line. It's obscured a little bit by the Louisiana line. But as you watch that, see that now California has gone down and they've bounced back up. California's numbers are high, but California's population is high. It's the size of 5 Washingtons. And so on a per capita basis, they're actually sort of the middle of the pack right now. But they're going up sharply. So how do we do all this? But the big thing I want to look at is the states that are having the most problem right now. You notice that these states that I've talked about with the second bounce are not near that New York line that's on the very top there. Instead, you have these other states that are showing up and they're headed toward the New York line. But the thing that I noticed when I did this hospital bed graph is they are flattening out in some ways. Very important. Flattening out does not mean going down. I do actually see hospital beds going down and emptying out in North Dakota in some ways. And by the way, people have said before, is that just people dying? And it is, part of it is people dying. But it's also not going up. Going down is still good because it means that there are more people coming in. And we can look at the proportion of people that are recovering versus the people dying. And I can tell you, this is not all, or maybe even mostly, people dying. This is mostly people getting better. And also, they're not being replaced as soon as they leave. So it looks like North Dakota is actually heading down. Nebraska is hopefully following North Dakota's path. And the thing about these graphs is because they simplify the curve of infection, you can see that once this curve starts to go down, it does start to continue. Now, South Dakota is sort of ambling down a little bit. I would love for this to come down a little bit more. But again, at least it's not shooting up, and they're still not at the New York capacity lines. Now, again, apples to oranges in some ways, because South Dakota's hospital bed occupancy is certainly probably less per capita than New York's. But also I was taking New York State's, whereas New York City was hit really hard. So all that is to say, we can debate the ins and outs of this. This is just meant to be a crude approximation. But what I want to show you is it's not going straight northeast at the same rate anymore. It is actually going more east than anything else. And North Dakota, in fact, might be going down. And I'm hoping the other states will follow that lead. You see, the Montana is actually going down a little bit as well, though they're sort of ambling a little bit like South Dakota. But again, ambling is better news than shooting up. The other thing that I'd like to show you, Iowa, by the way, they look like they're just starting to possibly flatten out. This can turn around, but in my experience, you see these other graphs, they didn't turn around, at least they didn't start shooting up that way. So all this is to say, right now, November 22nd, 2020, these states are hard hit on a per capita basis, but there are some signs that they might be flattening out, which doesn't mean that we need to completely relax, but it does mean that we can keep working and we can hope that our efforts are showing some fruit. The other one I'd like to point out is Ohio. Ohio has been hit with sort of a weird second wave. They've been kind of hit with two small initial waves, and this is the third wave. And this is hitting them harder than anything else. See, they're way up here, but they're still not on a per capita basis quite as bad as the other Great Plains states that I just showed you. And maybe this is my hopefulness speaking, but I'm looking at that graph, and it does look like it might be just starting to be pulled down right now. I'm hoping that that's right. It's still got some ways up to go nonetheless. All I can say is this is the data, the way that I processed it. I didn't put my thumb on the scale in any way, and I was hoping to see something that was at least not everything shooting up all the way, exponential growth, increasing and increasing. There is something that is pulling this down. The question is, what is it? Is it because hospitals are reaching capacity and now they're turning people away and some people aren't showing up? I am certain that it is partially that. But I'm also certain that there are some other things and other ways in which the tide of infection is turning. For example, the North Dakota infection rate is so high that probably 1/3 of the state has been infected by now. What this means is that any kind of separation that can be done right now of vulnerable populations in North Dakota would have big effects because it would protect them all the more. There's a 30% chance, if you just take people randomly from North Dakota, that one of them will have been infected at some point, and there's probably a 25 to 20% chance that one of them's infected right now. On the other hand, infected does not mean infective. So we've got to look at all these things, and we've got to say, we don't know why yet, but at least it's not exponential growth out of control. The virus might be losing a little bit of steam. That doesn't mean it's time to let up. It means it's time to focus all the more on hoping that this continues. Also, I was hoping that I would see better news for the second bounce states or the third bounce states, Washington, Louisiana, California, Ohio. They are rising, but also notice on this graph, they are lower. They are lower than on a per capita basis, and they are within capacity on a statewide basis right now. This is particularly problematic for California, right? Because again, it's like 5 states. I wish I had more detailed data, but this is the best I got right now. All we can say is that they do have capacity right now, but it's a worrisome situation for our whole country. At the very least, it does look like Florida is still within capacity, and this might be the time where some states give back to other states that helped them at the time. The question is, how much room do they have? But I think that we need to see how some states can help other states. This is not hitting every state the same way at the same time, but it's hitting a lot of states right now. So Washington, when I say that Washington has capacity, I mean this. Every morning I wake up, I open the Seattle Times, and I look at this graph, which is the graph of hospital occupancy of all patients and of COVID-19 patients. COVID-19 patients are the little dark blue line. Right now, today, 5.4% of the hospital bed occupancy in Washington is taken up by COVID patients. And the line of 80% is the line that we're shooting as a state to keep things below. We are below that line right now. Now you'll notice also that it has increased recently. It has even doubled recently. It's doubled from about 3% to about 6%. This can't continue, and it's going up at a fast rate right now. We've got to keep an eye on it. But for right now, hospital beds in Washington have capacity. And if we're seeing this pattern in this state, we've got to think about what it means and how we can apply it to other states and how we can't apply it to other states. So when I'm looking at this, I'm looking at capacity, and my biggest concern is to sound an alarm before Washington gets over capacity. And what I'm saying right now is I'm sounding an alarm that it's doubled recently, but we're still very far from capacity. It can double another number of times before we hit capacity. And in the other states I've looked at, it has not grown at a rate to exceed that capacity. That's what the data is that I just showed. The other thing is that there are overly pessimistic projections that I've been watching this for a long enough time. We've been going through this for, it feels like forever, right? And I remember these predictions. And so now is the time when I'm going to go into my files and I'm going to pull out the predictions that people made. And I'm going to do what scientists should do. See if your prediction was right. Here's a prediction from August 6th. I was skeptical of this prediction. 300,000 deaths by December was the projection of the IHME forecast. I used those forecasts, by the way, in my early data updates, but I sort of soured on them because they seemed to be too pessimistic. The more I compared them to what happened, the more it seemed like things didn't happen that way. And so they made those projections in late August, where you see the vertical line on this graph right here. And then the yellow line is what actually happened. The purple line is what the IHME said would happen. The yellow line is what actually happened up to mid-October, early October. And down below that is the blue line is the projections of Yu Yang Gu, who was my favorite modeler. He actually was very smart, and he said to himself, I think because of seasonality, I can't predict what the virus will do in November, so I'm not going to predict. Thankfully, he's back now, by the way. More on that on a future update, probably. But right here, what we have his predictions in blue, and you see that what actually happened through October was much closer to the blue line, his predictions, Gu's predictions, than to the purple line, the IHME predictions. What's happened since then? So I've sort of estimated, and I put it on there. And yes, things have risen. Gu was smart to stop calling off because we appear to have some kind of seasonality definitely having an effect, just like all coronaviruses did. I have another graph that you can go back and look at that shows in November things start getting hairy for those coronaviruses, and this one's doing the exact same thing. But still, even with the November surprise that we've seen right here, we are still below the lowest confidence interval for IHME. Now we're getting closer to it day by day, and the question is what's going to happen now. But I want to say that their prediction was off by 1/3. Judging from where we were when we made the prediction, where their prediction was going to be as far as total deaths, they predicted 300,000 deaths. We're now at 256,000, which means it's risen. They were only 66% right. They were 50% too optimistic, or 33%. I shouldn't do math in my head. All that is to say, the worst pessimism has not been borne out, not yet. And there's some signs with the Great Lakes, the Great Plains states, that I'm hoping that this will turn down and stay below that line. It's probably going to continue to go up, and it might eventually meet that line because of the seasonality. But it's not near the upper half. It might hit the actual line here. So, some more recent predictions, and I'll talk more about these. I've got screenshots of them. There's a recent prediction that was made just about a week ago that predicted on a basis that 2,000 deaths per day by December 2. I actually think that prediction left out some things, and I think that prediction was too pessimistic. I'm going to be more specific on December 2, because I'm going to say I think that there's going to be considerably fewer, at least 200 fewer deaths per day by December 2. If you extend this line right here, this is what it would have to do to be up by that point by December 2. We'll see who's right, and the other thing I can say is this worst case scenario would be about one of the best case scenarios that IHME would have predicted. So we're still better than the pessimists, and remember that the headlines seem to be driven by pessimism sometime. I do not want to be too optimistic, but I don't want to be too pessimistic either. And I want to say that we are in a serious situation right now. We need to do something, but we also have more help in our arsenal against this virus. We just had Regeneron's antibodies just got approved. We've got the vaccines are moving along better than I expected. So I'm hoping that those will start to hit the high risk categories by a month from now. And we will see. And then these numbers might actually be taken down by our technology. For now, we are still without that for another month, and we've got to see what will happen. So the questions now, I'm going to be doing more updates. I'm done with my classes, so I will be keeping a closer eye on this. Thanksgiving is coming. Will Thanksgiving cause the curves to go up again? Well, I'm going to keep an eye on that, and we'll see what happens. But I can say that those 5 states do have currently flattened curves that have flattened in the past week, again for the hospitalizations, which is not cases, but it's not. It's the thing I prefer to look at. So my recommendations for Thanksgiving. I'm not going to forbid you to go to Thanksgiving, okay? But I'm going to say every little bit helps. If you feel like you need to go to Thanksgiving, go ahead and please wear a mask at all times, other than when you're eating, Do it as safely as you can, because even if the mask does a 20% help, which is what I think it might be, it's just 20%, but 20% is really big, especially if it can prevent those curves from unflattening and starting to go up. What I would consider about this Thanksgiving, consider what would it be like if there was all this snow on the roads and there was a real risk of having an accident. If you would cancel, if that risk was too much, then consider canceling Thanksgiving or delaying it. You can have Thanksgiving whenever you want. The other thing is, this is more than a snowy road risk, because this could hurt other people other than you. But I do want to put the risk in some sort of calculation that's sort of like what we face when we go through a blizzard on Thanksgiving. There is a sharp rise in those 4 states that I mentioned, but also on a per capita basis, they're still below the Great Plains states. How long will that sharp rise continue? Will it start to fall off like I've seen Ohio do and like most of the other states have done? And how close will it be to that New York line? It looks like all those other lines are falling off before they get to the New York line, which at least they're not surpassing the New York line. Also, I'll take requests. I've got all 50 states here. It's just the ones I choose to look at and how many colors I can fit on my graph. So if you want to look at a particular state, I am definitely willing to take your request. Let me know in a comment or emailing me or whatever. And I also have data for European hospitalizations, and I can do the same kind of graph for that. I've looked at it really quickly, and it looks like all of them are going up right now except for Belgium. Belgium appears to be going down. Now, they've been hit super hard twice, but harder than I thought they would be hit the second time. But at least they are going down now, although the other ones still appear to be going up, and they are similar to their peaks at the first wave. So we'll have to see if they follow Belgium's pattern, but at this point, that's the best I can hope for, which isn't great. But going down, at this point, I'd just like to see the coronavirus go down. Okay. So with all of those updates, thanks for listening. Let me know what you want to look at next. And I'm going to keep my eyes open. I'm going to keep my my prayers going up. And we're going to see how this goes. If you want to know what I've done personally, I felt like the risk is too great for me to... I've had to cancel some Thanksgiving plans that I really wanted to do. So if you want to know what I'm doing, that's what I'm doing. And I'm frustrated about it. But I also feel like if I've been directed by the law to do this, even if I disagree that I want to assess my own risks, I have to face the fact that the law is, I think, wrong in some ways, but I'm going to follow it to maintain my own conscience. If you want to know more about that and my reasoning about that, but I just want to say I am foregoing Thanksgiving. I'm considering it to be the roads are too snowy for me this Thanksgiving. And all that is to say, everyone take care of yourself. If it snows, take care of yourself. If it doesn't snow, wear a mask as much as you can. I know it's uncomfortable and inconvenient, and you wonder if it does anything. And I think it does something. I don't think it's going to cure all our ills, but it's worth doing just because if it helps, the cost is very small. Okay, so all that's my data update right now, and I look forward. I hopefully will give you some more good news in about a week. Everyone stay safe and stay thankful.